Hi, everybody. Welcome to this lecture on wound care. My name is Dr. Brandon Gumbiner, and I am one of the podiatrists at KSB Foot and Ankle Center. I also staff our wound care center on Monday mornings. Um, and so we'd like to welcome you here to this event. And I'd like to thank KSB Community Wellness for sponsoring this event and asking me to be a part of it and for putting these things on. It's always great education for our community and to help the members of our community find the care that they need. So awesome. We'll get started here. Licking your wounds is not a treatment plan. If you logged in to see this lecture because you were surprised by that, I worry about you. But we're glad you're here. And yeah, believe it or not, licking your wounds is not a treatment plan. We are fortunate. We have a wound care center here at KSB. It's been open a little over a year now, and wound care and wounds in general are a big part of the healthcare system. This slide, I'd ask you to take a couple seconds and just kind of read through some of the statistics that are out there. And, you see this in the center of the slide talking about where are advanced wounds treated. And we'll get into this in the lecture, but there's some parameters that we look at in regards to, is the wound care we're providing, is that care appropriate? Is the treatment appropriate? And are the wounds advancing as they should? And one of the advantages of having a wound care center here now is that we are able to provide advanced treatment. The statistic is technically, if you have a diabetic wound that is not 50% smaller in 4 weeks, or a venous wound that is not 40% smaller in 4 weeks, then the likelihood of that wound healing is minimal. And that's where advanced therapies, advanced treatments come in. And we'll get into the nuts and bolts of that later in this lecture. But when you read through some of the statistics on this slide, you can see why this is such a hot topic. It's something you hear a lot of because it really impacts our society, impacts medical community, and definitely impacts the patients that we treat. So topics we're going to cover is just kind of some background, etiology of wounds. So what is a wound? Maybe you're logging in here and just because you're curious as to what is a wound and what does that mean and what does wound care mean? And so we're going to get into some of the etiology of what causes a wound. What's the role of a podiatrist? That's our bias. So what role do we play in that? Because wound care actually tends to be a fairly large part of our practice. We'll touch on the wound care center and some of the things that are offered down there and why that's important. And then what does the treatment involve? So the bare basics, and I'll kind of go back to your interest in wounds. Logging into this is maybe you have one, maybe you've had a family member who's had one, maybe you have diabetes and you want to prevent that. And you hear these horror stories of patients who have diabetes that end up losing a toe, losing a foot, losing a leg, and oftentimes that story starts with a wound. And we'll talk about, why that is, and then what can we do from a preventative standpoint. That's probably the most important piece. And I hope there's people logging in that are saying, well, I've heard these stories and I want to find out if I'm at risk for these things. So how do I protect myself? And it's always good to kind of get to these things from a preventative standpoint. So anatomy, this goes back to anatomy class. Skin is the largest organ in the body, and its job is to protect us. It is our barrier. It makes us waterproof on the inside. You don't jump into a pool and all your innards fall out. That's your skin that's holding everything together. And it makes up 16% of your body weight. It's composed of 2 layers. You may remember back to health class. It has an epidermis and a dermis. And those functions, there's sweat follicles and hair follicles, sweat glands or hair follicles. And, it helps regulate body temperature. It helps protect you from infection, all these sorts of things. And so when the skin is violated and there's an opening in the skin, well, that is a wound. And that is an avenue for infection, and that starts a cascade of potential complications. And that's what we're going to get into here. So definition of a wound is any damage which causes a break in the skin. Timing is important in healing these things. When we're young and healthy. We'll kind of go through the healing cascade of a wound here in the next slide. But when you get to these things acutely and your body is functioning as it should, you go through a process of healing. You skin your knee as a kid, and it bleeds. It forms a scab. And that scab falls off, and you pick at it when your mom tells you not to, and eventually the thing heals, and maybe or maybe not, you end up with a little bit of a scar. Some wounds are, and that's a fairly normal process. Some wounds get stuck and they're chronic. And we've seen patients. I actually have a patient right now. We've been treating for a wound that he's had for over 5 years, which is an opening in his skin that puts him at risk for loss of his leg. And so, these are things that we end up in our wound care center treating a lot of these chronic wounds where people have tried to treat them themselves, or maybe they've gone, they've only had access to a physician or a doctor that has minimal experience with wounds. And so maybe advanced treatments and advanced care hasn't been provided, and they get stuck with this chronic wound. The other aspect of wounds that we look at is the depth. So is this partial thickness? Is it full thickness? Is it all the way through the epidermis and the dermis? Is muscle or tendon exposed? Is bone exposed? And the depth of the wound will help determine the the prognosis of the wound and the healing potential and the treatments that are required, to get that wound healed up. So, this is a picture, oftentimes, and I've given lectures on wound care lots of places. And oftentimes when I talk to the community and we're talking about ulcers, we use the word ulcer. Most people in the audience are just picturing like a stomach ulcer, or the thought of a stomach ulcer. They haven't heard the term used for a foot. And, hopefully you're not eating lunch or dinner when you're watching this, but you can see, this is a picture of a foot wound or a foot ulcer. The term ulcer and wound are used in a similar fashion. They mean the exact same thing, but you can see that this is a breakdown of the skin, sometimes exposing muscle, as can be seen in these pictures. Sometimes it's a subcutaneous layer, which is the tissue just underneath the dermis, and sometimes it's all the way down to bone. So we'll kind of break down wound causes here. So there's lots of etiologies to it. You'll oftentimes hear diabetes in conjunction with wounds. That is probably the main comorbidity that we see when it comes to wound care. When we think about wounds, one of our first questions is always, does the patient have diabetes? And the question of why that is because diabetes is the leading cause to something called neuropathy. Neuropathy is a pathology within the nerves that most often manifests itself as loss of sensation or loss of feeling within the feet. And with that, what ends up happening is that you end up developing a wound. If you're a healthy person, you don't have diabetes, you don't have any neuropathy. If I were to put a rock or a tack in your shoe and tell you to walk 100 feet, you're going to be walking in a way that you're keeping pressure off where that tack is. You're going to walk on the heel, you're going to walk on the side of your foot, you're going to do anything you can to not put pressure on that, because as you're walking on that, one, it hurts, and two, it's violating the skin and it's causing an injury, which is potentially going to cause a wound. Someone who has no feeling and you put that same tack or a rock in their shoe, they're going to walk normal. They're going to walk just like there's nothing in there. And what that's doing is that is causing a disruption into the skin, which leads to a wound. In some regards, pain is a gift. When you don't feel pain, you don't know if there's damage happening to your skin. So diabetes, because of the neuropathy, is one component of that. The other aspect with diabetes is it's a leading cause for peripheral vascular disease or peripheral arterial disease, which also correlates with potential amputation, loss of circulation. So all of that kind of goes together. You see that we've listed the etiologies: diabetic, neuropathic, vascular, whether that's arterial or venous. Venous is a little different. That is extra swelling or fluid that will stay within the legs or the feet and doesn't go back into the venous system. And that extra fluid causes pressure against the skin, which can break down into a wound. We have some pictures of that later in the presentation. Traumatic, it's pretty self-explanatory. We see traumatic wounds frequently. Unfortunately, we're in a rural community. We do see a lot of farmers that end up with injuries, also just athletic injuries, things like that. Surgical wounds. So when surgery is performed, most of the time things heal just fine, but there's times where people react to suture. There's times where people react to the surgery itself, and maybe the incision doesn't heal well. Burns is another cause for wounds, and then pressure. And you hear about these in patients who may be hospitalized for a long time, or who sit for long periods of time, where they get pressure wounds on their backside. You can get pressure wounds on the heels, different parts of the foot. So that really encompasses all the etiologies from a 30,000-foot view. This is just to kind of help you visualize and picture, again, this wound or ulcer terminology and what it is that we're doing. This was a case of limb salvage. You hear that term thrown around frequently, and that's where a patient presents with a wound that is threatening their limb. This is a patient who came to us, had major circulation issues, had an infection, and ended up with an open amputation due to the infection. You can actually see bone exposed in the wound. And through diligent wound care, it took almost a year for that wound to heal, but you can see the picture on the left versus the picture on the right. And there were multiple skin grafts used and advanced therapies that allowed this patient to heal. You can kind of look through that picture on the right side and see the other foot that has had an amputation. And he had gone through a similar experience on that side that resulted in amputation, and we're trying to save this side, which we're able to do successfully. So this is where we pat ourselves on the back and feel appreciative of the fact that we're able to help somebody save their leg or save their foot when treating wounds. So you're watching this during February, which is Heart Health Month. And you might think, well, what does that have to do with wounds? And blood flow is probably one of the most important factors when it comes to healing wounds. And our heart is at the base of that. That's what's pumping to get blood flow down to our feet and down to our legs. And one of the biggest battles we face in wound care is that our toes and our feet are the farthest thing from our heart. And if you open up an anatomy textbook or Google the human body anatomy, you may see, what the vessels look like coming from the heart all the way down to the foot and leg, and they get smaller as you go. And, if you don't have good heart health, then there is a likelihood that you're not getting the circulation and blood flow that you need down to your feet to help heal these wounds. And so that's a big part of it. We talk about coronary artery disease. That'll be discussed during this month with heart health, and that's where you get blockage or clogging of the arteries around the heart. There is a correlation with peripheral vascular disease. We'll talk about that here in a second, where it affects the blood flow and circulation down to the legs. So here are kind of some pictures where you can visualize this peripheral vascular disease or ischemic ulcer component. And oftentimes when we see patients with wounds, there's you'll hear the term comorbidities, where there's multiple underlying disease issues. If you have coronary artery disease and vascular issues, it's likely you have kidney disease, and that in turn can affect your whole body system and how you are able to how your body's able to care for itself and how you're able to get through disease process. Well, here, you see a picture of an ischemic ulcer. Oftentimes, these are complicated by underlying diabetes. Oftentimes, these patients have a history of smoking. And, I'm reminded of a patient when I was a first-year resident in residency. Patient had diabetes, and patient was a smoker, and he ended up losing both of his legs. And I was in a VA hospital, and super nice guy. I really liked the guy and would visit him often. And one day he said to me, he goes, well, Brandon, He goes, everybody talked to me when I was smoking about lung cancer or throat cancer. And I always said, well, you got to die from something. But if somebody had told me that I would lose my legs from smoking, he said I would have tried even harder to quit. And what happens is diabetes can really affect the large blood vessels. And you see that picture there of clogging of the arteries, particularly at this place called the trifurcation, which is just beyond the knee, in the kneecap, where the main artery down to the foot splits into three. And just like plumbing, where you have a split, well, it's a place where things can get clogged. And so you can get blockage in those arteries, which lead to decreased circulation. And well, this is what happened to that patient, because not only do you have the diabetes, but with smoking kills off the small blood vessels. And so that picture on the right where you see these black toes, that's actually gangrene of the toes. And that can come on with critical limb ischemia. And the combination of both smoking and diabetes can really affect this. And this is a real battle that we face as wound care specialists and podiatrists, and something I see almost on a weekly basis, believe it or not. So again, caring for your heart, which will also help you care for your vascular system, can help prevent these things. But once you have an ischemic ulcer or a wound where there's no blood flow to it, we had a patient last week came in with a black toe. Unfortunately, there's nothing you can do, and you end up losing the toe, and you end up with amputation. We'll shift gears. So that was talking about arterial wounds or ischemic wounds where you don't have good blood flow down to the foot. Here we're going to talk about venous disease or venous ulcers. So arteries take blood from the heart out to the body, and veins take the blood after it's delivered its oxygen to the tissue and brings that blood back up to the heart where it gets reoxygenated. And if there's a disruption in the venous system, then it can cause this backup of fluid and can cause a breakdown in skin. What you see here, actually, I found this image online, but I thought it was excellent at showing, the progression of these things, and particularly that, we'll see patients in stage 1, 2, or 3, particularly stage 3, where there's just starting to be some discoloration of the skin. We're seeing some increased swelling to the leg, and we'll recommend compression stockings. And the conversation I always have with my patients at this stage is I say, wearing compression stockings is going to be preventative, because as this progresses, it's irreversible. And if you get to stage 4, stage 5, where you're developing wounds, it becomes harder to treat. And we do treat those with compression therapy, whether that's medicated wraps or being seen in our lymphedema center for massage and compression pumps. But you can prevent some of this stuff by wearing compression stockings early on. If you start noticing some of these varicose veins or leg edema, wearing compression stockings can prevent the progression of this. And venous wounds at times can be some of the hardest wounds we treat. And once you've developed one, you are definitely in compression for the rest of your life. So early stages, especially if you're working a job where you're on your feet for extended periods of time, you're standing a lot, standing long periods of time, wearing compression stockings is a great preventative measure to keep you from going down this cascade. This is kind of an impactful slide where you look at the 5-year mortality rate, percentage rate of multiple disease processes. And you look at lung cancer, from diagnosis of lung cancer by 5 years, you have a 75% mortality rate. And then you come down to major amputation. So if you lose your leg, you're a little over 50%, about 55%. Critical limb ischemia, we just talked about that, is almost equal, right around 50%. Minor amputation, if you lose a toe, you have almost, just under 50% 5-year mortality rate. And then you compare that to all cancers combined, which is just over 25%, right around 30%. Just having a diabetic foot ulcer puts you at just a little over 25% 5-year mortality rate. A condition called Charcot, which is something we see in patients who have neuropathy, hovers in right around there. And then breast cancer, which we hear a lot of and absolutely should. But I think, that's put in there as kind of an impactful thing when you see that the 5-year mortality rate of just having a diabetic foot ulcer is about 2.5 times that of breast cancer. And I think oftentimes people, at least the experience I've had with patients is, well, they think, oh, they got a wound and it's not that big of a deal. But when you look at the statistics of it and you realize that just having a foot ulcer puts you at almost 3 times the risk of death within 5 years as breast cancer does, that should really kind of hit an impactful note. So we talk about phases of wound healing, and this is what I talked about when you're a kid and you scrape your knee, or you cut yourself cutting vegetables. This is what happens. So stage one is hemostasis, right? The fibrin comes in and forms a platelet plug to stop the bleeding, and then it goes into an inflammatory phase where your immune system comes in and removes the bacteria, removes the cellular debris from the trauma, and allows all the bad cells to get cleaned out of there, so that then you can head into the proliferative phase where new blood vessels form in there, and you get reepithelialization where skin starts to grow across. And then once that skin grows across, then it remodels, uh, utilizing type 1 collagen, and that's the remodeling stage. Um, so thinking about that healing process, well, that healing process can get blocked at any one of those 4 levels, and that's how you end up with a chronic wound. When we talk about, well, what's the role of a podiatrist in that? Again, a lot of the wounds that are in our wound care center, the vast majority of them are lower extremity wounds, complicated by the things that I've talked about. Neuropathy that affects the foot and legs, circulation and vascular disease, which affects the foot and the legs. And so, podiatrist plays a big role in treating lower extremity wounds, and we have kind of a stepwise approach in how we go about treating that. We identify the cause of the wound. Is there one single issue? Is it pressure because of the way you're walking? Or is it multiple? Is it you have diabetes, you have neuropathy, you have circulation issues? Is there an infection? And so we're able to identify that and take a more holistic approach on it. And then we address each of those issues, as you can see listed here. Whether it's comorbidities that we're treating, whether it's multiple components affecting the wound, are further tests needed? Do we need to culture the wound? Do we need to get circulation studies? Do we need to get x-rays? Is there underlying bone infection? What's the biomechanics of the foot? We can address all of that sort of stuff in regards to healing. So treatment, really the basics of wound care comes down to a couple of things. Wound debridement is probably number one, which allows us to remove biofilm. It allows us to remove bacteria that lives on the wound, and it helps stimulate healing. It brings bleeding to the wound. Oftentimes chronic wounds have tricked your body into thinking there's not a wound there. By debriding the wound, which is cutting the wound, causing it to bleed, removing tissue from it, it re-stimulates that healing cascade so that your body can go through that and know that it needs to heal. When it's venous wounds, then it's compression. Having compression to offload the pressure that's on the skin. Those are the bare basics. But you see what's listed here: wound debridement removes the biofilm, stimulates healing process. Offloading, utilizing padding or boots or some way to mobilize and get pressure off these areas. There's multiple topical medications that we use, whether they're antibacterial or sometimes just keeping a wound moist that's really dried out. Dressing changes, compression therapy, and sometimes surgical intervention. If there's some underlying biomechanical cause or some underlying infection, oftentimes that will have to be addressed from a surgical standpoint. You may have heard about hyperbaric oxygen chamber treatment. And this is kind of a picture of what a HBO chamber is. And what that does is it delivers 100% oxygen to your body and to the wound, increases the oxygen to the blood. And I think if we go to the next slide here, this is kind of a better image of how HBO therapy works. It is an adjunct therapy, and there are certain qualifications you have to meet to be a candidate for it. But the patients that we've been able to utilize it for, the bare basics, it increases the oxygen delivery to these wounds to allow for appropriate healing. So, in conclusion, every patient and wound is different, and so it requires a professional that is experienced with wounds, um, to determine through thorough evaluation what's the underlying cause, and that has to be addressed. So proper examination, proper testing where needed, with the ultimate goal of healing the wound as quickly as possible. Because as long as it's open, you are at risk for infection. And so, ultimately, we want to get you back on your feet as soon as we can. Here's contact information for KSP Hospital Wound Care Center, and there are multiple providers down there that are totally capable of helping you out, and we're there 5 days a week, staff 5 days a week, and we've got an excellent team, a great team of people to go through this process with you, to come alongside you and work to get this thing healed. I think one of the great things about wound care centers in general is that it is a team approach to getting you better. And we've seen lots of people. There's probably some basic wounds that people can get, and they can be treated appropriately by the primary care doctor or wherever they're at. But for the wounds that are stalling out, the wounds that are chronic, the wounds that are difficult to heal, complicated by multiple comorbidities, it's a real advantage to have a team of people to come around you and help you through the process of getting these things healed up for you so you can get back with your life. These are my partners, Dr. Kyle Swanson and Dr. Nathan Maurin. We're up here in the Foot and Ankle Center and the Wound Care Center. We really pride ourselves on a team approach to medicine, podiatry, foot and ankle work. And we have availability every day of the week. We're really good about getting people in quick. So if you have any foot and ankle issue, if you have a wound issue, usually if you call us, particularly if it's a wound, we can usually get you in the same day. And these are things that we don't waste time on because they can go bad fast. And we just view it as a huge honor to serve this community. And anything you need, feel free to reach out to us.